Let's rewind things a little bit. The world was such a different place 5 years ago, seemingly coming to a halt right around this time of year as COVID-19 is spread across the world.
It was 5 years ago today, on March 12, 2020, when then-Mayor Bill de Blasio declared a state of emergency in New York City. On the same day, the curtains went down on Broadway as then-Governor Andrew Cuomo announced restrictions on public gatherings.
Sports leagues also coming to a stop. The NCAA announced all championships were canceled, including March Madness. All major sports leagues announced a pause as well.
But since then, so much has changed, but some problems are still lingering, like the issue with mental illness on streets and subways of New York City.
1 in 5 New Yorkers experience some form of mental illness in any given year, and hundreds of thousands are not getting the care they need.
It's a complicated issue, but one local leader says there could be a solution hiding in plain sight. Here's Eyewitness News investigative reporter Dan Krauth.
It's been 3 years since Michelle Go was shoved onto the subway tracks in front of an oncoming train in Times Square, killing her. The man who's accused of doing it has a history of mental illness.
Why? I got a gun. I couldn't do it.
And hasn't been prosecuted in court yet because he has been found unfit to stand trial.
I asked myself the same thing I'm sure your viewers asked, which is, why was this person not in treatment?
All this time later, Manhattan Borough President and former health chair Mark Levine says the city's still not close to solving the complex problem.
The whole system is underfunded. There's a shortage everywhere, and it lets people fall into the cracks.
I'm sorry.
We've seen firsthand the mayor's outreach teams walking the streets and subways trying to get people help. A lot of that help involves quick stays in local emergency rooms. According to the borough president, about 1,000 people are on the wait list for long-term community-based treatment. Meanwhile, the number of inpatient psychiatric beds statewide dropped by 12% over close to 2 decades. New York City alone lost more than 450 beds. The problem became worse during the pandemic when many of the psych beds were converted to COVID beds.
We've recovered none of those beds, as far as I can tell, with only a few exceptions.
Levine believes there's a solution hiding in plain sight. The state-run Manhattan Psychiatric Center on Ward's Island. 2 of the 3 buildings on campus are sitting empty.
It's this huge complex that at one point had 4,000 patients. At this point, it has 400.
It would take the city and state spending hundreds of millions of dollars to make it happen.
Yes, that would be a good idea for some part of the population, but not the entire population.
Perry Perlmutter, who runs a nonprofit for the underserved, says the industry is moving towards long-term community-based care to not just treat the mind, but everything the person needs to get back on their feet.
They'll learn how to deal with their finances. They'll learn about food. They'll learn about how to deal with their mental illness or their substance use problems.
The state told us the governor's working to do both. In a statement, they said she has dramatically increased inpatient bed capacity across New York State, including the Manhattan Psychiatric Center on Ward's Island, and dramatically expanded community-based mental health services for New Yorkers living with mental illness.
Right now, we're facing a crisis on the street.
Either way, it's a complex problem with expensive, complex answers. Dan Krauth, Channel 7, Eyewitness News.
Tonight, Eyewitness News will take a deeper dive into the 5th anniversary of the pandemic. What have we learned? How has this virus changed all of our lives so many years later? Well, join us for our special COVID Impact 5 years later right here on Channel 7 and ABC 7 NY tonight at 5:30.